Um, welcome back to our final session of the day today, which is session 4, Enhancing Regional Resilience in the Current and Future Global Context. We will explore regional cooperation models and present case studies from Asia and the Pacific. Our speakers for this sessions are Dr. Anthony So, Director, IDEA Initiative and Distinguished Professor of the Practice, Johns Hopkins Bloomberg School of Public Health, USA. Dr. Piti Srisangnam, Executive Director, ASEAN Foundation, Jakarta, Indonesia. Dr. Matthias Helble, WHO Geneva. This session is moderated by Mr. Yern Fai Lee, Associate Economic Affairs Officer, Trade, Investment, and Innovation Division from UN ESCAP. Please give a warm welcome to them.
Hi, good afternoon, everyone, and welcome back from the break. So as the MC kindly introduced, my name is Yern Fai Lee. I'm from United Nations ESCAP. We are based here in Bangkok. We are a regional commission of the UN, so we are the headquarters, so to speak, for Asia Pacific. And we're very happy to have you here with us for this session, session 4, on enhancing regional resilience in the current global context. In the earlier sessions today, we've heard about the current landscape that we are in, this environment that we are in now, and there's also mention about the experience we've had from the pandemic, the inequities we've seen, the challenges we've had. And so with this recent history, and in this global context, where we have this rapidly changing, this very dynamic environment, not just in trade, but in health and various aspects in the global order, all this underscore more than ever the importance of regional cooperation, of strengthening regional cooperation. And particularly with the challenges we've seen in the multilateral system, perhaps there's a shift, that there is a place, there is scope for us to look more towards regional platforms, regional, sub-regional arrangements that could play an increasingly vital role in enhancing regional resilience. And so in the following 60 minutes or so, we hope to explore some of these questions on how regional mechanisms can be leveraged to build stronger, more adaptive and inclusive systems, including perhaps how can countries work together better to enhance regional resilience. What are some of the good or best practices that could be implemented or that could be considered for regional integration? What are some platforms that we could think of to work together better? So we have, I think, up to 4 speakers actually. And before I move on to our first speaker, I would just briefly mention that at ESCAP, we have a research project where we've commissioned studies to look at regional integration and cooperation through different lenses, trade policy, innovation, technology transfer, to promote affordable and equitable access to essential medical products in Asia and the Pacific. And there are some of these studies, and some of the findings have been synthesized and drawn out, and you might see some of that in the presentation of our first speaker. And with that, let me pass the floor to our first speaker, Professor Anthony So from Johns Hopkins.
Thank you so much, and thanks to the conference organizers for the opportunity to share some reflections on enhancing regional resilience in the current global context, and to UNESCAP for their support on this project. UNESCAP has a project that builds upon a series of commissioned country-level case studies, including Thailand, Bangladesh, Cambodia, the Philippines, and Sri Lanka. And I will try to provide a potential framework to hopefully spur discussion on how to improve regional integration and cooperation to promote affordable and equitable access to vaccines, diagnostics, and therapeutics in the Asia-Pacific region. And I think you'll hear in the talk much of some of the themes we actually started discussing this morning that I will try to pick up as well and provide some more concrete instantiation. So just going to the next slide, So in the regional and global context, the case for improving integration and collaboration is that there is a symmetry across countries in the globalized disease threats that we see crossing political borders. Historically, this is focused on infectious disease threats from SARS to COVID-19 and Mpox that have readily crossed borders. Increasingly, though, food products not only bring infectious disease threats, but also non-communicable disease risks that have become a greater share of our burden of disease. And we also know in the Mekong Delta region that disease vectors, whether it's carried by mosquitoes or waterways, can create common risks that straddle and cross borders as well. And those risks are amplified by climate change. Now, the asymmetry of globalization is that these disease threats readily cross borders, but the means to address them may lag behind. And that asymmetry actually can lead to global health inequity. Going further, if you look at a study that looked at the launches of 119 medicines over a 4-decade period, where they found that the median time from the first launch globally to availability on the local market, it ranged significantly from under 3 years for high-income countries to 8 years for low-income countries. That's a 3-fold difference, actually, in the time it takes for drugs to reach markets in low-income countries compared to high-income countries. And this gap was stubbornly persistent and wide over time. So such are the delays for gaining access to new health technologies in endemic or ordinary times. But in pandemic times, the stakes are much higher. Modeling projections actually have shown that had low and middle income countries received access to COVID-19 vaccines within the same vaccination rates as in high income countries, more than half of the deaths that occurred in the first year of the pandemic might have been averted. Now, the Asia-Pacific region is home to over 4.8 billion people, 60% of the world's population, and its 50-some countries and territories are a diverse lot. In defining where and how countries contribute and fit within this regional and global pharmaceutical value chain, we might roughly sort countries into 5 categories. Innovation leaders like Japan and the Republic of Korea with robust R&D capabilities and regulatory authorities, strong domestic production, and global competitive advantages. Emerging players like Thailand and Indonesia with growing pharmaceutical sector, increasing domestic capacity, but reliance on imported active pharmaceutical ingredients. Manufacturing hubs like India and China that excel in pharmaceutical production both for domestic and for export markets. Import-dependent countries like the Philippines, Sri Lanka, and Cambodia, characterized by limited pharmaceutical production capacity and high import reliance. And finally, advanced markets like Australia that make substantial investments in healthcare delivery, have robust regulatory systems and health technology assessment capabilities, but are significantly actually reliant also on pharmaceutical imports. Now, these are not meant to be ironclad categories, but rather archetypes. India and China both have significant R&D capacity as well. Singapore might well straddle more than one of these archetypes. But the majority of countries in the Asia-Pacific region are import dependent. However, as the country case studies that UNESCAP Commission reveal, there are promising national efforts to better position countries in the pharmaceutical value chain. Today's import-dependent countries may aspire to be tomorrow's emerging players or innovation leaders. For example, for improving R&D, the Philippines established pharmaceutical economic zones and offered a menu of incentives to foreign investors, not limited to the pharmaceutical industry. Sri Lanka also established a zone specifically for pharmaceutical and medical device manufacturing, coupled with government incentives. For regulatory cooperation, regional efforts, supported by ASEAN's Pharmaceutical Product Working Group, has sought to eliminate duplicative reviews to the ASEAN Common Document and Technical Requirements. The Asia-Pacific Economic Cooperation, or APEC, Life Sciences Forum, Innovation Forum, actually has tried to work towards regulatory convergence. And to support local production, Bangladesh has taken advantage of its least developed country status under the World Trade Organization and provide tax holidays and export subsidies for producers of active pharmaceutical ingredients. In Thailand, of course, the government pharmaceutical organization has served as a major supplier of essential medicines and generics, and the Thai Ministry of Health, in a partnership with, of course, AstraZeneca, Siam Bioscience, and Siam Cement Group, committed to a strategic partnership that led to the country being the first in Southeast Asia to produce a COVID-19 vaccine. We've already heard from Dr. Stewart earlier today about the complexity, of course, of managing a pool procurement system and, of course, a government manufacturing system in the country. In Sri Lanka, lacking sufficient domestic demand to achieve economies of scale, the country nonetheless contributed to meeting the global demand for personal protective equipment, face masks and surgical gloves, and respirators by ramping up and exporting these products during the COVID-19 pandemic. Now, at the regional level, the Republic of Korea became a global training hub for biomanufacturing with the support of the International Vaccines Initiative, which it has supported for years within its borders. And the WHO's mRNA Technology Transfer Program, co-led with the Medicines Patent Pool, has enlisted manufacturing partners in India, Pakistan, Indonesia, Vietnam, and Bangladesh. Now, to manage cross-border trade, various countries deployed differentiated tariff schedules. So, as I understand it, Thailand had exempted from tariffs the import of certain vaccines, primarily those not manufactured by domestic firms, from the 25% tariff otherwise applied to this class of products. Sri Lanka, interestingly, positioned itself as a producer of intermediate products for India's pharmaceutical industry, both manufacturing glass vials as well as syringes. And the regional trade agreements, like the Regional Comprehensive Economic Partnership, have sought to eliminate tariffs on vaccine secondary packaging and to lower barriers for imports of personal protective equipment. But perhaps the most powerful instrument for positioning in the pharmaceutical value chain is public sector procurement. And you've heard this, of course, a couple of times so far today. In Thailand, the National Health Security Office had significant sway over public hospital procurement. And this monopsony power has enabled the government to negotiate concessionary prices reductions and to realize significant savings. In Sri Lanka, interestingly, the State Pharmaceutical Corporation has implemented a guaranteed buyback agreement to procure locally produced pharmaceutical products. And this has enabled them to actually encourage local manufacturers to meet a growing percentage of the government's pharmaceutical needs. Now, by and large, these policy instruments that I've described are ones in which individual countries are jockeying to better position themselves in the pharmaceutical value chain. But the question before us is how to motivate regional collective action. And in an earlier analysis we conducted for UN ESCAP, we focused on COVID-19 vaccine access. Now, as this quadrant diagram on the left shows, we looked at risk and resilience against pandemics through the lens of the COVID-19 response. Those countries which are highlighted in red are those classified as the least developed countries by the World Bank. Now, in the quadrant diagram, you will see that we divide the countries into 4 buckets. Those on the left-hand side of this diagram fell short of achieving the WHO's target of 70% vaccine coverage by December 2021. That's a year after the introduction of COVID-19 vaccines under emergency use authorization in the world. Those on the right-hand side of the quadrant diagram succeeded. Those on the top half of the quadrant diagram reported having some domestic vaccine production capacity. And those in the lower half of the quadrant diagram have only limited, have no actually such capacity. Now, to be clear, countries like Myanmar, for example, which are in the upper quadrant of the diagram, may have only very limited capacities, fill and finish with Sinopharm. But importantly, the point of this quick sort is to suggest that many countries in the Asia-Pacific region would have shared reasons to find a path to reduce risk and improve resilience against a future pandemic. The upper right-hand quadrant are those that possess both local vaccine production capacity and the ability to deliver COVID-19 vaccines. Now, they might have a greater sense of national health security, but others, to varying degrees, may find that the security is in regional collective action. Now, many of the smaller countries, especially those classified as low-income countries, public sector procurement may not be sufficient to position themselves effectively in the global pharmaceutical value chain. And as the chart on the right-hand side of this slide shows, that to introduce COVID-19 vaccines and reach 70% coverage, the UN Development Program calculated that high-income countries would only have to increase their healthcare budgets by 0.8% to achieve that target. But if you were actually low-income countries, you would have to, on average, increase your budget by over 50% to actually achieve that same level of vaccine coverage. So health security for these countries will require external support. And with the falling away of global health donor aid, this creates the political space for considering a regional approach. Now, we discussed the array of approaches by which individual countries might, from the bottom up, position and upgrade their position in the global or regional pharmaceutical value chain. How might we think about how a regional approach to integration and cooperation work? Where might one cite local production of pharmaceuticals? Well, we might draw some insights from the work of the Children's Vaccine Initiative. A couple decades ago, Amy Batson and Peter Evans came up with this visualization that you see on this slide here, later adapted here, and into zones where WHO and UNICEF might prioritize their targeting strategy for scaling and ensuring sustainable vaccine supply, and in this case, largely children's vaccines. The horizontal axis captures the size of the country's population. The vertical axis captures GNP per capita. So the bigger the population and the greater the economic wealth of the country, the more likely it would sustain domestic manufacture of vaccines, and the less external support, it was argued, it might require. The implication was that local vaccine production might scale more sustainably in a country whose internal market size was big enough to give it economies of scale, and whose economic wealth actually could enable it to buy security. But we know from the experience of the COVID-19 pandemic that local manufacturing does not guarantee regional health security. Domestic priorities actually may take precedence over commitments to serving a regional market, particularly during a pandemic. Geopolitical tensions may also limit trade among countries. Consider that Asia-Pacific region is really made up of multiple distinct subregions. Trade among countries, for example, in the South Asia subregion comes to only 5%. But whereas trade among ASEAN countries comes to 22% of overall trade. To mitigate against that first risk of domestic market priority, you might consider, for example, deliberately investing in a country with a smaller domestic market, so that that country would actually need to export its pharmaceutical product to sustain its domestic industry. And that would be an extra incentive for, obviously, it to be helpful during a pandemic, because its industry would rely, in fact, on that export market, not just on serving its domestic market. To mitigate against the second risk of geopolitical tensions, one might need either to construct a regional coalition too big or broad to ignore, or to have strategic alternatives, building in planned redundancy of supply. And we talked this morning a little about the geopolitical tensions between the red and blue team, as they call it. And again, how does one play actually with that in what would be actually a regional coalition of the willing? So let's look at this regional coalition of the willing. The regional collective action will require a coalition of the willing, and this might take any of a number of forms. It may be sub-regional or beyond regions. But as illustrated, history, economic ties, and cross-border traffic and trade can serve as a useful foundation for sharing risks and building resilience together against future pandemics. And as in our quadrant diagram, the countries at greatest risk of limited access would have more motivation to join the coalition of the willing. For these countries, the priority, of course, would likely focus on regional pooled procurement as well as regulatory cooperation and cross-border trade. Now, for a country, though, with significant domestic manufacturing capacity, but with interest and commitment to supply other countries, they might be more keen, though, about a different part of the pharmaceutical value chain, investments in R&D and local production. And then, of course, there may be multiple countries that might have geopolitical or economic reasons to support the initial coalition of the willing. Then the coalition of the willing might have options for alternative sourcing, and this can be made easier to negotiate for a supply arrangement that yields the most equitable allocation of pharmaceutical products in the countries of the Coalition of the Willing. So now taking a regional approach to build this Coalition of the Willing might benefit from recognizing the different roles that countries actually will play in the pharmaceutical value chain. And we might actually more intentionally consider whether those policy instruments that we use are ties that bind or ties that bridge. This distinction actually builds upon the framework of social capital, popularized and developed by Robert Putnam in his classic work on the American community, called Bowling Alone. He defines social capital as the connections among individuals' social networks and the norms of reciprocity and trustworthiness that arise from them. And that's what we're doing, using policy instruments to build reciprocity and trustworthiness among a community of nations. Ties that bind are exclusive, inward-looking, among homogeneous groups with shared history, trade, and ties, cultural ties, and among whom in difficult times there's a getting by sense of solidarity that to come to one's mutual aid. Among these countries, regulatory harmonization, trade facilitation measures, and surveillance come easier. Ties that bridge are inclusive, they're outward-looking, bringing together heterogeneous or different groups. The glue is one of getting ahead by accessing new information, resources, and opportunities beyond one's immediate network. And examples here might be knowledge networks or technology transfer hubs. And I'll also point out that some of these ties may be outside of the trade of pharmaceutical products, but used to leverage concessions for health security. So if you are actually, for example, a manufacturer of intermediate inputs for actually, say, the auto industry in Vietnam, and you actually, there may be a vested interest in those who are receiving those intermediate inputs from Vietnam to in fact make sure that Vietnam's actually health and productivity of its population is sufficient to actually maintain no supply disruption of that intermediate product. Or rare earth metals has come recently to mind, of course, as another leverage point in trade. Now, ties that bind and ties that bridge are not mutually exclusive, but just a construct to help one strategize. Strategic pool procurement may involve a coalition of the willing built around those at greatest risk of limited access to needed pharmaceutical products. These might be insulin or expensive biologics for cancer treatment in endemic times, or vaccines and rapid diagnostics in pandemic times. For this coalition of the willing, this shared risk may be a tie that binds. But partnering with a country with significant domestic manufacturing and export capacity as a supplier in the strategic pool procurement arrangement may be a tie that bridges. And a regional financing facility might put funding into that country to ensure that it can meet the supply needs of the coalition of the willing. The Asia-Pacific region really faces new urgency to deepen regional integration and cooperation for health product access, with both COVID-19's lessons and with the withdrawal of high-income donor aid, creating unique political opportunities for regional collective action. And this coincides with the emergence of new collaborative platforms from ASEAN and APEC's response to COVID-19 and the mRNA technology transfer platform to new alliances for economic security like the Regional Comprehensive Economic Partnership. And as Carlo Castrin also was mentioning earlier, these developments have shifted the Overton window, or the policy window of opportunity, to consider pool procurement facility for a coalition of the willing in the Asia-Pacific region. And this may be also integrated with a facility contracting or even building or siting its own local manufacturing facilities for essential pharmaceutical products. And we can talk a little bit more about that vertical integration that you see between these two areas of pool procurement and local manufacturing. By boldly expanding the boundaries of what we might be considered possible through regional integration and collective action, the Asia-Pacific region could, in fact, transform health security into a shared regional public good. And the Overton window is not just a metaphor, it is an invitation to lead, to ensure that the people of this region will have both equitable and enduring access to vaccines, therapeutics, and diagnostics in the years to come. Thank you for the opportunity of sharing these reflections with you today.
Thank you very much, Professor Anthony, for that very insightful and comprehensive presentation, really setting the scene, and I think drawing out the points that I think is on a lot of our minds. How do we get countries to work together? The question of, we do talk a lot about we need more cooperation, but how do we do it? How do we incentivize countries? How might such an arrangement look like? And with that, I think we can move on to our next speaker, who will give us a regional or sub-regional perspective, so to speak. So could I invite Dr. Piti Srisangnam, who is the Executive Director of the ASEAN Foundation. He's speaking online.
Thank you very much, Mr. Moderator. Can you hear me loud and clear?
Yes, we hear you fine.
Thank you very much. And of course, greeting to all distinguished participants. It is an honor to share the ASEAN perspective in these critical discussions on trade, health, and resilience. I'm talking to you from Kuala Lumpur, Malaysia, because I just finished my last sessions on the summit related meetings. And I can guarantee you that we are in the world where geopolitical confrontation has replaced corporations. ASEAN has different deals with the US without mutual negotiations. Some are forced to deal on the topic related to the rare earth minerals, to the technological war, and it will create another tension, especially with another superpower country, which is China in the near future. So I'd like to start my talk by share my PowerPoint presentation. I would like to present on the topic of enhancing regional cooperations in the current global context. So like I told you earlier, we are meeting in the world where geopolitical confrontations has replaced corporations and geoeconomic has become the new weapon of choices. Superpower, especially China and the US, are decoupling supply chains, restricting technology flows, and reconfiguring alliance. So these new realities threaten not only trade stabilities, but also our collective capacity to protect public health. Hence, ASEAN positions between competing poles of power. Understand this deeply. Like I told you earlier, we just finished the ASEAN summit, and we see a lot of these tensions. Our experience offers lessons on how regional cooperation can restore balance, resilience, and most importantly, trust when multilateralism falters. So let's see the lessons from existing regional corporations or the lesson learned from ASEAN. ASEAN journeys teach us the regionalism must evolve beyond trade liberalizations. It must become a shield of resilience in times of global fragmentations. First, institutional mechanisms matter. The ASEAN Comprehensive Recovery Framework, or the ACRF, developed in the aftermath of COVID-19 pandemic, integrated economic reopening with public health recoveries, showing that collective actions can build connectivities faster and more equitably than isolated national responses. So that's the first lesson learned. The second lesson learned, cooperations across sectors is very essential. Health resilience depends on smooth trades, and trade resilience, on the other hand, also depend on healthy peoples. ASEAN Regional Reserve of Medical Supply, joint procurement initiatives, and pandemic response coordination illustrate how cross-ministerial cooperations between health, trade, and finance can deliver tangible outcomes. The third lesson learned, digital integrations enhance preparedness. Through the ASEAN digital health ecosystems and cross-border paperless trade initiatives, ASEAN member states are building platforms for data exchange and supply chain traceabilities, critical for both trade facilitations and health securities. The final lesson learned, inclusion builds legitimacy. Partnership with civil societies, micro, small, medium-sized enterprises, academia, and the private sectors ensure that regional framework reflects the needs of citizens, not only the needs of states. The ASEAN Foundations, my organizations, play a key role in nurturing these people-to-people's linkages, translating policy commitment into social participations. So the second topic is about strengthening regional framework to complement global efforts. Regional cooperation must complement and reinforce global multilateralism, not replace it. I would like to emphasize again, we need to reinforce the global multilateralism, not replace it. ASEAN model of open and inclusive regionalism seeks to bridge global frameworks like the WTO, the WHO, UN ESCAP with the reality of Southeast Asia. Under the Regional Comprehensive Economic Partnership, or the RCEP, the largest FTA between ASEAN 10 countries plus China, Japan, Korea, Australia, New Zealand, ASEAN promotes trade facilitations for essential goods and digital health products. Initiatives aligned with, of course, the WTO trade and health agendas, and of course with the WHO pandemic agreements. Yet complementarity alone is not enough. We must build policy coherence. This is the thing that we need very much for ASEAN right now. Trade negotiation with the US is the very good example. Without policy cohesion, we end up lost. We end up losing our bargaining power. Hence, we must build policy coherence across health, trade, technologies, and environments. Regional data governance, mutual recognitions of health professionals, and resilience logistic networks are as important as tariff reductions. So in short, effective regional framework can serve as the operational layer of global corporations where norms meet realities and policy meets people. So from ASEAN experiences, the third part I would like to share with you is about the key drivers of ASEAN resilience and connectivities. And these three factors are very vital. The first one, I'm talking about the diversifications of self-reliance without isolations. The pandemic revealed the dangers of excessive dependence on a few global suppliers. ASEAN's strategy is to diversify production base for pharmaceuticals, medical equipment, and food securities. Hence, projects like ASEAN Smart Logistic Network, or the one that Thailand promote a lot during the time of chairmanship of the APEC summit, is the Bio-Circular Green BCG Economic Partnership, help create balanced regional ecosystems, enhancing both economic and health resilience. The key factors number two, or the key drivers number two, human capital and digital connectivities. Of course, we are talking about Go Digital ASEAN, right? The next generations of resilience lies in peoples and data, not just good. The region must move from trade in goods to trade in skill and knowledge. Health workforce mobilities, mutual recognitions of medical qualifications, and data governance standards are central to all connectivity agendas. By promoting regional upskilling in data science, digital literacy, and responsible AI ethics, as through ASEAN Foundation Digital Inclusions Program, like I show you on these slides, we are empower our citizens to adapt to a rapidly changing economies where digital and health governance intersect to each other. At the ASEAN Foundation, we support this through digital literacy programs such as ASEAN Digital Literacy. We end up empower more than 200,000 people on digital literacy. AI Ready ASEAN. For the next 2 years, we will empower ASEAN with a skill set of responsible and ethical use of AI. We are talking about 5.5 million ASEAN under these new initiatives, ASEAN AI Ready ASEAN. AIM ASEAN, or the AI for MSME initiatives. This one, we are going to empower ASEAN SME, 120,000 of them, to know how to adapt these new technologies in doing business. Hence, we empowering citizens to participate safely in the digital economies. And the third drivers, multi-stakeholders inclusions. Government cannot act alone, as well as private sectors, they cannot act alone as well. So the private sectors, universities, civil societies, all the actors, all the players take parts in building adaptive networks. A resilient regions must be networked, trust, and inclusive. So together, these factors define ASEAN model of strategic autonomy, especially between the rivalries of power between China and US. ASEAN need the model to ensure their strategic autonomy, rebalancing, being open to all, aligned with none. Being open to all and aligned with none, as well as resilient amid the world divides. This is the thing that we need very much. Of course, the last topic that I would like to touch upon is the role of WHO. The World Health Organizations remain the central pillars of global health governance. But the current geopolitical realities, where even the major power like the US question the legitimacy of multilateral institutions, call for the urgent reform. The WHO must evolve from a reactive to a proactive organization with greater agilities, with more transparencies, and of course, with the regional partnership. The WHO should, number one, empower regional offices, such as WHO Southeast Asia Regional Office, CRO, to play a more strategic role in coordinations with sub-regional mechanisms like ASEAN. Number two, enhance independence from political pressure and funding asymmetries that undermine global solidarities. Hence, we need more independence. And last but not the least, the third thing we need for the reform of the WHO is modernize its mandate. Modernize its mandate to reflect today's interconnected world where health, security, data governance, and trade policy intersect. So in short, a reform of the WHO must be the anchor of a renewed multilateralism, not throwing it away, but we need to renew our multilateralism mechanism, one that reflects equity, inclusivity, and respect for the voice of course, the global south, the countries in developing world, the least developed countries. So to conclude, ASEAN experience reminds us that resilience begins regionally, but solidarity must remain global. In a time when globalization is contested and the multilateral order is fragmenting, regional corporations offer a path to renewal, not retreats. Renewal, not retreats. Trade and health are no longer separate pillars of policy. They are the twin engines of human security. As ASEAN, we remain committed to an open, inclusive, and people-centered cooperation model, when regional resilience serves as the foundations of global stabilities. So that's the thing that I would like to share from my point of view as both international trade economist and the executive directors of the ASEAN Foundations. So if you would like to learn more about us, this is us. This is our team, ASEAN Foundations. You can scan the QR code to learn more about what we do right now at the ASEAN Foundations. So thank you very much. ขอบคุณครับ
Thank you very much, Dr. Siti, Prof. Piti, for giving us the ASEAN perspective and for highlighting the different factors of what make ASEAN tick, so to speak, and also highlighting the areas that you think could be strengthened. And I think I draw some common points as well with the first presentation about the issues going beyond health. That it's multidimensional now. We need to look at cross-sector considerations. And with that, let's move to our next speaker. We have another regional perspective coming to us from Latin America. We have Mr. José Daniel Rengifo Martinez. He's from the Office of International Affairs at the National Institute of Food and Drug Surveillance of Colombia. You have the floor, please.
Thank you very much. Do you hear me?
Yes, we can hear you. Yes.
Yeah, perfect. Thank you. I have some slides. I think they are going to share my slides. From the IT team.
They are in the process of doing it? Yes, okay.
Okay, perfect.
Yeah.
Thank you.
Yes,
Thank
we
you
see
very
your
much.
slides, yes.
Perfect. Thank you very much. First of all, thank you for the kind invitation. I will try to discuss in a really short time an initiative we've been working on from Colombia. Colombia currently holds the presidents of the CELAC, which is an important regional mechanism in Latin America and the Caribbean. We are building an initiative related to regulatory convergence. It may be linked to a platform, or it may be linked to a Latin American and Caribbean medicines agency. That's something we're been working on with other countries. And this proposal emerges as a structural response to the regulatory fragmentation and external dependency that characterize the region's health pharmaceutical systems. So this is like a short introduction to the topic. Latin American and Caribbean countries face divergent regulatory requirements, limited shared technical capacities, leading to high cost and delays in population access to medicines, which is a big problem in a lot of countries right now in Colombia, in Latin America and the Caribbean. So regulatory convergence, understood as the gradual harmonization of standards, procedures, and practices between national regulatory authorities, in this case, in the regional level, represent the central axis of this initiative. This platform or agency of Latin American agency is conceived not as a supranational authority, replacing national regulators, but as a technical and political cooperation mechanism that coordinates, strengthens, and supports them with a regional initiative for regulatory convergence. Its ultimate goal is to ensure equitable and timely access to safe, effective, and quality medicines, while contributing also to stronger local and regional research and develop and innovation and manufacturing capacities for medicines, for vaccines, and from other health-related technologies, as well as promoting, of course, public and public-private partnerships that support these aims. So can we go to the next slide, please? Next slide. Thank you. So there's a political and technical background in Latin America and the Caribbean regarding this initiative. The process that gave rise to this regulatory convergence initiative has a strong regional political foundation, driven by the Plan for Health Self-Sufficiency in Latin America and the Caribbean, which was published on 2021 by CELAC and CEPAL. This plan identified the creation of a regional regulatory coordination mechanism as one of its priority lines of action to facilitate production and access to medicines and other relevant technologies. Since then, there have been significant events or milestones. There was a CELAC summit in 2023. From that summit, there was the Acapulco Declaration, which was signed by Colombia, Cuba, and Mexico, specifically COFEPRIS from Mexico, SECMED from Cuba, and INVIMA from Colombia. And they committed to work towards a regulatory convergence initiative to strengthen regional health sovereignty. Also, there was an important Bogota meeting in June of 2023. In this, there was the participation of national regulatory authorities of reference in the region, which are Argentina, Brazil, Chile, Colombia, Cuba, and Mexico. The meeting basically reaffirmed the need to strengthen regulatory convergence and to set up technical working groups to identify regional needs in terms of access to medicines. Finally, there was an important milestone last year, Kingstown Declaration. In this declaration, the CELAC heads of state emphasized the importance of health self-sufficiency and strengthening regional production of medicines, vaccines, and other health technologies, while also supporting the creation of a regional regulatory agency as a mechanism for integration and cooperation in regulatory convergence. Next slide, please. So, why a regional medicines agency in Latin America and the Caribbean? There are three main reasons. The first one, I already talked about that one, is the regulatory fragmentation. There are wide disparities in national regulatory frameworks across Latin America and the Caribbean, making it difficult to build strategic alliances to overcome access barriers across countries. Also, there are existing regulatory requirements that may hinder the development of local and regional research and development capabilities, given the context in which they are created, especially in biological medicines and vaccines. In a study that's currently being developed in Colombia, there are some results that can be shown already. More than 85% of medicines and active pharmaceutical ingredients used in Latin America and the Caribbean are currently imported. And the lack of harmonized regulatory, this is like a conclusion from the initial findings. The lack of harmonized regulatory capacity and the absence of mutual recognition hinder the development of regional value chains and local production projects due to high regulatory uncertainty. So there is a need of strengthening a local market, a common market in Latin America and the Caribbean through this process of harmonization, regulatory harmonization. And finally, there is a context of inefficiency and duplication of efforts. Each national agency performs similar tasks, for example, dossier evaluations, good manufacturing practice inspections, among others. There is a strong opportunity to reinforce cooperation processes that support regulatory convergence towards building regional value chains for production and distribution of medicines, vaccines, and other health technologies, of course, relying in other important regional initiatives in these matters that are already working in Latin America and the Caribbean, in America in general, the American continent. Next slide, please. So what are the main expected benefits from this proposal? First of all, I want to reinforce the idea that this is a cooperation platform. So this initiative seeks to operate as a regional technical political mechanism that promotes regulatory convergence. So this is done by harmonizing standards and processes, sharing information, building mutual trust, which is really important in our region, among national agencies to improve access to medicines, vaccines, and other relevant health technologies. And we have these main expected benefits from this cooperation platform. You may call it a platform, you may call it a regional agency. What we expect from this cooperation platform is to boost regional production through a more predictable market with lower regulatory risk, taking into account the context I just told you about, reduction in registration timelines through joint evaluations and other convergent mechanisms, increased transparency and trust via regional publication evaluation reports, strengthening of technical capabilities, and also improve pharmacovigilance and post-market surveillance through a regional laboratory network and shared alerts. So I just want to say regarding these main benefits that this is a work that's complementary with national agencies. The initiative will not replace national regulatory authorities, but it will serve as a technical coordination instrument that fully respects sovereign national competencies. Just to take into account, we have been talking with important shareholders in order to understand how the process of building these regional cooperation platforms was made. For example, we have been talking with the African Medicines Agency, that was created through an international treaty, which is in force since 2021. Its purpose is related in some matters to the Latin American and the Caribbean context regarding harmonizing regulatory frameworks, support local production, and strengthen trust among states. Also, it has received financial and technical support from the European Union and the EMA, highlighting the value of interregional cooperation mechanism. And it shows that consolidating a regional agency requires a progressive legal foundation, a phased governance, and an initial focus on areas of high public impact, such as generic medicines and biosimilars. And these lessons are fully transferred to the to the Latin American and the Caribbean context. We have also been studying the experiences of the EMA in Europe, and a successful example of regional regulatory convergence. Next slide, please. So what actions are we planning to take into these initial pilots of regulatory convergence in Latin America and the Caribbean? There are some short-term actions and there are some medium and long-term actions. In terms of short-term actions, there have been discussions related to defining a list of priority products for joint evaluation, essential medicines with major public health impact, also formalize our regional technical groups to address central components of the initiative, such as governance and sustainability and regulatory needs prioritization, and also implement pilot of sharing inspections and cooperation agreements between official laboratories. Next slide, please. Also, in terms of medium and long-term actions, we'll be working on developing a legal framework for mutual recognition among national agencies, just as the examples I just told you about in Africa and also in Europe, establishing a financing strategies with diverse sources, not only sources related to the fees, but also national budgets, maybe international cooperation, among others, standardized procedures and dossier formats for prioritized medicines, such as OTC medicines, which has been an important focus of work from INVIMA last year with other national regulatory agencies across Latin America and the Caribbean. Also consolidate a regional network of laboratories and pharmacovigilance with a permanent exchange of alerts and post-market surveillance, as I told you a moment ago. Coordinate strategies between patent offices. This is a really important issue. Coordinate strategies between patent offices and regulatory agencies to ensure strict patentability standards and prevent barriers to access arising from monopolies linked to lax intellectual property protection, which is a big issue in Colombia, especially in biological medicines and vaccines. We have pretty interesting examples of how these conversations between patent offices and regulatory agencies may work, for example, in Brazil. Establish a regional pharmacovigilance system, also expand joint evaluation initiatives. So next slide, please. So this is an executive presentation about this initiative we've been working on. The Regional Regulatory Convergence Initiative represents a historic opportunity for Latin America and the Caribbean to move from fragmentation toward effective cooperation in health regulation in order to or aiming to promote access to medicines and vaccines and other health technologies. There are political instruments that already exist and they are helpful for this task. The CELAC instruments I just told you about, Plan for Health Self-Sufficiency by CEPAL and CELAC, multilateral declarations and commitments, among others. The next step is to operationalize political with true concrete pilots that demonstrate the benefits of regional convergence in specific products. And in a context, and some of my colleagues have spoken about this, in a context where multilateralism appears to be weakening globally, regional cooperation stands as an ideal and necessary vehicle to address the public health needs of Latin America and the Caribbean related to equitable and timely access to medicines, vaccines, and other health technologies. Thank you very much.
Thank you very much, Jose. That's very interesting, and I think it's exciting to see this initiative happening in another region of the world. And I think there are many lessons that we would be able to draw from as we see it developed and see how it might be applicable to Asia Pacific or different subregions of Asia Pacific. And with that, for our final speaker today, we will hear from the perspective of the WHO. So we have Dr. Matthias Helble. He's a scientist at the Science for Health Department at WHO. Matthias, you have the floor.
Thank you so much, Yern Fai. Can you hear me? Okay.
Here you are.
Thank you so much for the invitation also to participate in this conference. I'm really sorry that I cannot be there in person. It would have been great to meet you all and catch up with old friends and colleagues. Today I will talk about a recent paper that I have co-authored with colleagues from WHO on vaccine production and to look at regional solutions. Can you see my slides?
Yes.
Yeah. Okay. Because I think it's good after these talks that were not intervention specific to look at a specific product type, namely vaccines that were at the forefront of our fight against COVID-19, and to better understand how regional cooperation could look like. So I have divided my presentation in three parts. First, I would like to quickly review the main principles of the vaccine markets and the production. Then I will talk about possible elements of a regional strategy for vaccine production, and then I will highlight some open questions that are very practical, and I hope we can have a discussion afterwards on some of those questions. When we look at the vaccine market globally, we can distinguish certain elements. First of all, when it comes to the level of competitiveness, we know that certain segments are actually very competitive, especially for childhood vaccines. For newer vaccines, there is less competition and higher margins. Yet one needs to understand well where you enter the vaccine market. We have strong incumbents in the vaccine market, which again makes the barriers to entry high. And I think what's also particular about the vaccine market, we have very large public sector purchases, especially in LMICs. And some of those provide market assurance and predictability, again, which is important for vaccine manufacturers. When it comes to production principles, we have large economies of scale, especially for the traditional production methods. It is changing now with the mRNA technology. We have considerable capital and labor investment to get the vaccine production going. And then in terms of scalability, when a pandemic hits, it's important to know how quickly I can scale up the production of vaccines. We didn't have a big scalability for the traditional platforms. Now with mRNA, that is changing, and it's becoming more flexible in terms of production. Now, when countries decide to strengthen or even get into vaccine production, it's important to understand that we have global supply chains that enable productions. And on the right, you see a picture that I took when I visited the BioVac plant in South Africa 2 years ago. And a lot of the equipment actually is, of course, not produced in South Africa, but needs to be imported. And so this vaccine production requires imports from a lot of different countries where, of course, the trade element becomes very important. Then, of course, the question is should a country or a region start with fill and finish, or should they aim for a fully integrated production? Of course, the implications are quite different. Fill and finish, you still depend to a large extent to another manufacturer. Fully integrated, of course, means a lot of additional costs to make it really a fully integrated production. And finally, and we already touched upon this, are a lot of regulatory and safety requirements, because of course we need to make sure that the vaccines are safe. Now, when we look at regional strategies, we know that R&D in new vaccines and also the production of vaccines, they require substantive investments. And one could argue that those investments can be more easily shared across countries. So that's a strong argument for regional cooperation. And of course, as I mentioned, we have a lot of economies of scale. So having a regional market that works as one allows for more cost-effective scale in terms of production. We can also think about, when we have a region working together, we have a larger pool of skilled workers, and we need a lot of specialized skill to produce vaccines. And if those workers can move across borders easily, that of course helps for the regional vaccine production. Then we already heard about procurement mechanisms. This can of course help if the region comes together and purchase in a coordinated fashion. But of course, there's a bit of tension between, we want to of course support regional production, which at the beginning could imply higher costs. At the same time, the region works together to bring the costs down from a perspective of purchasing new vaccines. And of course, and we also already heard this also from our colleague from Colombia, it's good to aim for regional regulatory harmonization, mutual recognition agreements, etc. So of course, in this slide, I just would like to highlight again that there is a very close linkage between this production at the regional level of vaccines and regional trade. For each of the elements that I mentioned previously, we need to make sure that the trade policy is in line. For example, of course, if I want the regional market to work as one, we need to ensure that these vaccines are traded seamlessly across the region. When it comes to skilled workers that move around, we could, of course, build on RTAs and services, put procurement provisions, etc. So let me now go to my last slide, and because we're a little bit behind time, and I think these are very important questions that need an answer, and I hope we can discuss some of them in the remaining time. First of all, it's about how to define the costs and benefits and to ensure their equitable division among regional partners. Because of course, setting up a regional vaccine manufacturing and also maybe an R&D implies, of course, costs. And how should we actually define those costs? Because we need to think about how to set up, but also to maintain these facilities. When it comes to benefits, of course, we have benefits in terms of an outbreak, in terms of course, having the vaccines readily available. But benefits might also include positive externalities from a local vaccine manufacturing plant. So how do we define those, and how do we divide them across the regional partners? Then, of course, we want to ensure that in an outbreak situation, this regional cooperation really continues, because that's the whole purpose, to have set up this regional cooperation mechanism. Then I think it's also interesting to think about regional value chains. Can we split up basically the different stages of the vaccine manufacturing across the region? And I know that Latin America has tried this. For Asia, this could also be an option to actively try to think about how to enable regional value chains, and of course also to try to facilitate the transfer of technology within the region. Then I think it's important to mention that even though we try to be, as a region, independent from the world, we still often need global sourcing. And how do we make this global sourcing of certain inputs into vaccine manufacturing reliable and resilient whenever the next pandemic strikes? In terms of regional strategies, we have already heard from our colleague from Latin America and ASEAN. In Africa, they also try to have a more regional cooperation in terms of vaccine manufacturing. Let me just finish by mentioning an example that, for me, even though it's old, could teach us some lessons in going forward. After the Second World War, they founded the European Coal and Steel Community, which was based on the principle of supranationalism, governed by the creation of a high authority. And I think these kind of regional mechanisms that build on the idea of supranationalism are still the way to go, because then you can ensure that you have the competences shared across countries. And of course, then it would also make sure that in case of a pandemic, it's much more sure that the benefits of a regional, for example, vaccine manufacturing is shared across the region. With that, and I think I stayed exactly within my 10 minutes, let me hand back over to Yern Fai. Thank you very much.
Thank you very much, Matthias, for giving us your thoughts on the elements of regional strategy, and also finishing off with some very thought-provoking questions. A lot of food for thought there. And we have run over time, but I hope we can take one or two questions. Do you have any questions from the floor? Yes, Ambassador. Could we have a microphone?
Thank you very much for the. It is not set up for me, for my height. นึกไม่ออก No, thank you very much for very, very concise but very interesting presentations from all of you. They all give me hope that regional cooperation may be a solution, at least for the short and medium term. But what I observe is that from Professor Anthony, who gave us the broader view of what regional cooperation can do. But when we see the ASEAN example and the Latin American, I think they're focusing on different things. I don't know whether it's because of, okay, my question is, okay, I think existing regional establishment or bodies are very important on what we can do. Because like Dr. Piti example, that ASEAN has long been working on this, so it is maybe a little bit easier to continue to do on production and to start working on real production and supply chain coordination in the region, because we already have long established existing body here. But the Latin American example I saw is that they are focusing, for Mr. José, you presented that you are starting with regulatory coherence and harmonization. So my question is, maybe addressed to Professor, that is the existing organization or regional setting vital for how we are going to do regional cooperation in terms of healthcare? I don't know whether you understand what I'm asking. It seems that different regions can do, but they have to start at different angles. Thank you.
Indeed, I think this is a great question, and I think probably to be fair also to Latin America region, I don't think that Jose maybe spent as much time to discuss PAHO's efforts in regional pool procurement, which are rather long-standing. I think several decades, in fact, for regional pool procurement on vaccines, and also a comparable facility on health commodities, which is now, I believe, under one umbrella. And that, in fact, has preceded, in some ways, the CELAC initiative that's more focused on regulatory harmonization. It'd be interesting to hear from Jose how those are related, because obviously they should be integrated in some ways. I think the opportunity actually in the ASEAN region is particularly exciting, because you have, in fact, many countries that are well positioned as import dependent. And in fact, you also have some real powerhouses in R&D and manufacturing in the region, some of which have geopolitical tensions that can be used to your advantage, so long as you can put together first a strategic coalition of the willing. And there are many major geopolitical powers that actually would do a lot, I believe, for a combined ASEAN actually group of countries. And I think is that strategy of creating that first, within the value chain, I would suggest picking pool procurement, because it looks both
backwards, upstream towards, in fact, the R&D, and of course, downstream towards, of course, the purchasing power of healthcare delivery systems. Using that pivot point, I think you can also look at very strategic ways to vertically integrate your value chain. And I didn't get as much into it today, but I'm happy, of course, to explain more. But I think there are ways in which to, of course, coordinate the procurement with, in fact, manufacturing. And that you have some of that, of course, in Thailand. There are challenges, but there are ways also to do this even more effectively. In the United States, for example, we have, of course, a system which is much more private sector oriented, but we have created, in fact, a third of the hospitals in the country in the United States have banded together to create a non-profit generic company called CivicRx that is, in fact, manufacturing generic medicines at the behest of its members, which are the hospital systems of the country, which control 1/3 of the hospital beds in the United States. Using that actually as a membership model, they in fact have every incentive to actually make sure the pharmaceutical products that they manufacture are close to marginal cost pricing because those are the members, the delivery system. So they've actually vertically integrated now some of the healthcare delivery system with the procurement, but they actually do more than procurement. They actually are now they either contract or build manufacturing plants. In fact, they're supplying California now with, or soon to be actually, with insulin dosing that actually will be much more affordable in our healthcare delivery system. So you can see, and in fact, the first 2 products they contracted for were antibiotics, vancomycin and daptomycin. Why is that so important? Some pharmaceutical products are simply not going to be scaled at the sort of prices we're seeing for cancer drugs. They need to be at close to marginal cost pricing. And that's where a nonprofit model in the healthcare delivery system, where there's a parastatal like the GPO here with the National Health Service Organization, or whether it's actually, or Butantan Institute and Biopharmaceuticals in Brazil, or as it is CivicRx as a nonprofit model in the United States. These are the models that actually become your backstop for the public sector to make sure that, in fact, the pharmaceutical manufacturing approach is close to actually meeting the public interest goals of the healthcare delivery system. Because otherwise we do face a lot of the challenges of the current pharmaceutical model bringing things to market. So I think there is useful integration possibilities between manufacturing, procurement, and of course the healthcare delivery system that we could actually take advantage, particularly in this region.
Thank you very much. Do we have another question? I know time is running tight. So if I may just ask the other 3 speakers online in response to the Secretariat's interest, if you could suggest just one research question for this conference to take forward, what would that be? I know Matthias has raised a lot in his last slide, but if you could just raise one research question. I think we'll go first with Dr. Piti.
I think right now with the geopolitical tensions and the collapse of, not collapse, the problems with the multilateralism forum, I think we will see more towards the so-called mini-lateralism. Hence, I think for the research questions, we may need to think about what is the topic that Thailand, that ASEAN should propose to create our own agenda of this mini-lateralism, especially at the WHO, WTO meeting, right? In order to drive our agenda forward at the global level. And of course, if there will be more countries who agree with this agenda, that will create a snowball effect. And this mini-lateralism will enlarge into the new flexible multilateralism. Hence, the research question is, what is the topic? What is the agenda that Thailand and ASEAN countries should push forward, should propose, should initiatives at this mini-lateralism forum? So that's my thought.
Thank you very much. Maybe we move to José.
Thank you very much. That's a really interesting question. As I was telling in a part of my presentation, there is a global context where multilateralism appears to be weakening. So maybe My personal research question is how can regional cooperation initiatives on regulatory conversions, but on other matters as well, can help strengthen regional markets to overcome barriers to access to medicines? That will be but maybe really specific, but it's an interesting question we have been asking ourselves in Colombia and in Latin America.
Thank you very much. And last but not least, Matthias, if you want to highlight one.
Thank you very much. I think we all agree that multilateralism is in a crisis, but I think we could still use this multilateral or international platform to look at efforts across regions. So because regions are making different experiences, and I think this sharing of those experiences across regions is very important. So my question would be, what can we learn across regions, and how do we actually need to build those sub-regional institutions? And of course, each region will have a different setup, but still, I think there are learnings across regions that can be made, and I think WHO is basically open to facilitate such an exchange. Thank you very much.
Thank you very much, and I thank all the speakers for your participation and everyone for your patience bearing with us. We've run over time. And that concludes the end of this session. Thank you.